A few people arriving. We'll just hang on. That's it. Okay.
Okay, hello everybody, and welcome to our session today, hearing from Oxford Health on their draft strategy. So the format of today's session is Oxford. We have speakers from Oxford Health who will take us through a presentation and talk through their draft strategy. There will be opportunities for people to ask questions during the presentation. And you can also put questions in the chat bar function as well, and we can pick these up either during or at the end of the presentation. So I will hand over to Veronica now to introduce our speakers.
Yeah, so we're jointly running this session, Healthwatch Oxfordshire and Healthwatch Buckinghamshire, because Oxford Health stretches its footprint right over the two areas. We're really pleased to have Amelie Bages and Sam Shepherd here today from Oxford Health to talk about their strategy, which is going into the future and setting their next steps. So I'm going to hand over to Amelie, and a warm welcome to you.
Thank you very much, Veronica. Laura, if you want to put the slides on screen, I'm just going to wait. Thank you very much. And if you go to the next one, the next slide. So I'll start speaking, and Laura, you can move on to the next slide. So, hi everybody, I'm Amelie Bages. I'm the Executive Director of Strategy at Oxford Health, and I lead on the long-term planning for Oxford Health, which is the mechanism through which we look at the improvement that we need to make and how we're going to make this happen in the coming years. So we're having this webinar today because we are developing our next strategy for the next 5 years. And I first wanted to thank you all for taking the time of joining us today. And we're really keen to get your feedback, your views, and that will help us finalize our strategy by this summer. I'm joined by my colleagues Sam, Laura, and Helen today. So what I'm going to do is tell you a bit about Oxford Health. We're a quite complex organization, so I think it's important to understand broadly what we do. Then I'll tell you about the work we're doing to develop our strategy, and then we're going to go through the content of our proposal, and I'm really keen to get your feedbacks. So Laura, if you go to the next slide. I first wanted to start by explaining a bit what Oxford Health does. So we are a large NHS organization, and we provide care both for mental health, but also for physical health delivered in the community. We operate across a very large geography. So our main services are located in Oxfordshire and Buckinghamshire, and our headquarters is in Oxfordshire. But we also provide very specialized mental health services in a much wider geography. We provide care through hospitals, clinics, building in the community, but we also provide care in people's home. For example, we have district nurses going into home, we have nurses going into schools, etc. So we operate across large geographical areas and very different types of buildings and settings. We employ roughly 7,500 staff, and we have a budget to deliver healthcare of roughly 700 million. So, as I said, quite a complex organization and spanning both from mental health to physical health care and really all ages. So we're looking at the full health span of people when thinking about our work. If you go to the next slide, Laura. So why are we developing a strategy? Well, we're a very complex organization, and it's really important for us to be clear with our colleagues who are working in the organization about what we're asking them to improve and how we're asking them to do that, and to do that over the next 5 years. So it's really important for our colleagues in Oxford Health to be very clear about what's the plan, what are the priorities. But it's also very important for us to be clear with our communities, our patients, and the people that are interested in our work about what we're planning to do and for them to be able to input in that process and to give us their feedback. So that's really why we're developing the strategy. In addition to that, we are a big NHS organization, and the government has published a 10-year health plan and has asked all NHS organizations in the country to look at their strategies and align them to that national plan. So the national plans probably say three things, which are the key priorities are providing healthcare closer to home, so both that applies to both mental health and physical health care. To use digital technologies more to improve access and the quality of care for people, but also to make the job of colleagues working in the NHS easier. And thirdly, there's a need to focus much more on preventing ill health and tackling health inequalities. So that's kind of the ask that we've been set by the government. So when we look at our strategy for the next 5 years, we are thinking about the national plan, but we're also thinking about working with our partners in Oxfordshire and in Buckinghamshire. How can we work together to deliver these? And what are the needs of the people and the communities in these areas, and how can we address them? So that's what we are doing with our strategy. So if we go to the next slide, Laura, I just wanted to say a bit about how we are going about developing our strategy. So we're doing this in two phases. The first phase, that one from September to December, was really an early engagement phase, and we gathered feedback from patients, carers, families, expert by experience, colleagues working in Oxford Health and partner organizations about what is Oxford Health doing well, what is not working very well, what could we be doing differently. We gathered all of these views, and as a board of directors, we looked at this feedback and we've developed a draft proposal for our strategy. And now we're in the phase 2 of engagement where we're sharing that proposal. It's on our website, there's a survey available, we're doing webinars like today, and we're asking people to feedback on it, give us their thoughts, and we'll take all of this input and we'll aim to finalize the strategy by this summer. And from then, it will really help us guide the work that we do and how we engage with our patients and communities. So if you go to the next slide, Laura, I just wanted to share a little bit about the feedback that we've heard through the phase 1 of engagement. That one, as I said, from September to December, especially with our patients, families and carers. So we've held group sessions with expert by experience, which are people with experience of healthcare in Oxford Health that we employ in the trust. We've also gathered views through a public survey, and we've also used our networks through our services to reach out widely and gather feedback. So what we heard is that there is a strong appreciation for the professionalism, the compassion and the commitment of the colleagues who work at Oxford Health. However, there are ongoing concerns about access, especially about waiting times, the referral process, the reliability of appointments. There's also difficulties with travels, location, navigating services, and especially for people who live in rural areas, which we know obviously is a key characteristic of some of our geographies, but also with people who have additional needs. And there's a clear need for better communication, smoother handover between different teams and services. There's also a strong call for people with lived experience to play a bigger role in shaping our decisions and our services. And that includes a better recognition and support for carers of people who access our services. And finally, there's clearly, in line with the national view, a strong interest in help and prevention and intervening earlier to prevent ill health, but also joining up mental health and physical health care more. So that's what we've heard from the phase 1 of engagement. And as I said, as a board of directors for the organization, we took all of this feedback on board and thought about, okay, what does that mean for us for the next 5 years? That's what our local community is telling us, and we know what the government is asking for us. So what we're going to do now is we're going to go through our proposal, we'll describe the different elements for you, and then we'll pause and give you an opportunity to have a chat and ask questions. But before we do that, I just wanted to say a few words about our current thinking and our current draft. So when thinking about the next 5 years, we've identified 3 aims, which is really what we think good would look like in 5 years if we achieve what we want. The first one is around our patients, but also their carers and their family. And it was very important, based on that feedback, that we don't only talk about patients, but we also talk about their support system, so carers and family. And one of our key aims for the next 3 years that we are proposing is improving the quality of life, but also the experience of care for people. I think it's really important to recognize the importance of improving the experience of the care, and we're getting more sophisticated and we have more data to be able to do that. So that's our first aim for the next 5 years. The second one, which is a clear shift from what our current strategy says, and we wanted to make it very explicit, is around improving the health of our communities and more broadly of the populations that we serve. We know that the NHS, the budget will not be sufficient in the future to address all of the need that is growing, and therefore that we need to think differently and at a higher level about how we make the best use of resources that are available. So what we're saying with that second aim is we recognize that as an organization, our job is not only to look at people who are already accessing our services or waiting to access our services, but it's also to think about the people that we may not be seeing, but may need to be seen. So it's a very clear shift about recognizing that our responsibility is broader and that we need to work with other organizations to think about, okay, when we look at the needs of the population overall, what needs to be done differently? What are the inequalities that are not being addressed? And I want to emphasize that second aim because for our colleagues working in Oxford Health, some of them are already doing this systematically, but for some other colleagues that are facing huge pressures in their day-to-day job, it's not an easy ask to be put on them, but we think it's a right one as an organization to recognize that our role is broader than just looking at our patients. And finally, our third aim for the next 5 years is around our colleagues, so the people who work at Oxford Health. We know that as a healthcare organization, we cannot deliver great care, we cannot improve the experience of people who are accessing our services if our colleagues are not thriving and are not supported to do their best at work. It's an essential element of ensuring that the quality of care is great. So as an organization, we're recognizing that for the next 5 years, we really need to put huge emphasis on enabling our colleagues to feel included, supported when they work at Oxford Health and to thrive. So I just wanted to say that as a matter of introduction, and then I will hand over to Sam, who is going to take us through the different elements of the strategy. And as I said, there's an opportunity to share feedback, ask questions as we go, and me and colleagues will try our best to answer and have a helpful discussion. Thank you.
Amelie, can I just ask, the slides are still on the one for what we've heard from patients, families and carers, so yes. I don't think we got to see the ones that describe what you were talking about. Is that correct?
Yes, I think we're going to come to it now. Thank you.
Hi everybody, my name is Sam Shepherd and it's a delight to be here this afternoon. The aims that Amelie was just touching on, what we're going to do now is we're going to go into each element of our strategy and we'll do that piece by piece so that we can bite off what we can choose, so to speak, and start to be able to really get into some more detailed discussion and questions about each element of our draft strategy that we're proposing. So I'm going to start very much at the top here with our proposed vision and purpose for Oxford Health for the next 5 years. So if I start with the vision on the left-hand side here and this purple red box, we aspire to be an organisation that delivers compassionate and effective care and treatment to support people to achieve their best quality of life. We really heard through phase 1 that our vision should be very much grounded in patient care. And so this is a vision that we're proposing that we believe says what does good look like for the long term. But we are also proposing to have a purpose going forward, and that purpose would be to provide great care delivered by great teams. We have, up until this point, had a vision and a mission. But what we have heard in phase 1 of our engagement is that having a vision and a mission is quite confusing, and it's not clear what the difference is between those two things. So we are proposing here that we have this vision statement, which says what it is that we want to achieve and be in the long term. What does good look like over that long term? But we want to be really clear about what our purpose is as an organisation, so that it's really succinct and really clear why we're here and what we do. So we'd really like to take the moments here with people in the room to explore, are these statements clear? Do they really reflect what it is that you want from your healthcare? And does the direction here feel ambitious, but also grounded in reality, recognising the context that we work in? So if colleagues and people attending would like to use the chat, or indeed if you feel able, please put your hand up and come on into the conversation. We'd really like to take the next few minutes to hear your thoughts around these proposed vision and purpose. So please do come on in. We've heard from patients and carers and staff through this phase of engagement. We've also heard from our own staff around what they think, as well as partners. But we'd be really keen to hear those in the room. If you've got any questions about these, please do use the chat or come on in with a hand up. Hi there, Mike. Come on in.
Mike.
Do they, sorry if this sounds negative, but do they actually mean anything? What health organisation doesn't hope to be compassionate, effective, give high quality care and have a great team?
Thank you, Mike. I'm picking up from your comment there that you feel as though these are a little bit stating the obvious.
Yeah.
I think to respond, certainly around our purpose, we really do want to be clear that if you hadn't come across Oxford Health before, what our absolute core purpose is of an organisation. So certainly recognise that point with regards to the purpose. But Mike, could you come on and just give us a little bit more around what would you like to see around our vision in particular, which is that forward-focused statement? What is it that you think would help it feel less?
I think, in my view, I question the value of visions and purposes generally if they are just stating, as you describe it, broadly what you'd expect, the obvious.
Sure.
And it's the devil is in the detail and how you're going to deliver this with diminishing budgets and all the pressures upon you.
Yeah, and I think Sam effectively we'll go to the detail of the how when we look at our ambition for the next 5 years and the priorities, which I think will feel a bit more concrete and more specific. And I think that links with the question from Barbara in the chat about how we will measure how we will achieve this vision. What we're going to do is we're going to identify what our aims are for the next 5 years, and then we'll identify very clear outcomes that we want to deliver. We haven't done it yet because we're waiting to finalize this, but we will have clear outcomes that we will publish and that we will monitor.
Yeah, absolutely. So really hearing that both from Mike and from Barbara, that we need to think about those specifics. Thank you. I've got a question in the chat here from Alison. How does this fit in with what you said about supporting the wider social network, carers, etc., and also in prevention in the first instance. And I think, Alison, it probably will be helpful for us to move on to the next elements of the strategy in order to be able to help answer that question. But we wanted to start here as that kind of, real statement of what it is that we're here to do. So please do bear with us on that, and we'll come to you.
Thank you. If I can add on this point, on the question from Alison, I think also when we say our vision is around people achieving their best quality of life, we know that part of that is obviously helping people, health not deteriorate. So there's an element of prevention of that, because as someone receiving healthcare, obviously your quality of life is greatly improved if you receive treatment early and before your condition deteriorates. So I think that's how we're capturing it in the long-term vision.
Thanks, Emily. And a comment here that the vision statement is stronger than the purpose of being great. So thank you for that. That's DJ Mystery. So appreciate that comment. Just this one is a really tricky one for us to balance. The question at the bottom here, does this direction feel ambitious but realistic? And in recognition of all of those things that we must deliver as an NHS organisation, we wanted to be really clear that we want to deliver great care. We have also heard feedback that the word outstanding, which is something that we've considered using and is indeed in our existing strategy, is a word that's very much associated with the CQC, and we don't do things for the purposes of CQC. We do things because they're the right things to do, and we aren't writing this strategy to speak to that audience. So did just want to share that with you, but thank you for the comment. Thank you, Veronica, too, for the reminder around using abbreviations. CQC is the Care Quality Commission, which of course makes judgments about the quality of care across our entire sector. Amelie, did you want to come in?
Yes, if I can just say about our purpose, something that has come out quite strongly from our engagement, but also from our discussion as a board of directors, is it's really important to emphasize the importance of teams. People working at Oxford Health deliver the best care and support, people improving their quality of life when they work as teams. So that's also something we really wanted to keep. It's in our current strategy, but we wanted to emphasize that because the unit of a team and the multidisciplinary element of the work, having people from different professions working together and working with other organizations, sometimes as a team, is very important.
I think, Veronica, you put your hand up?
Yes, I think that comes back slightly to that previous comment we've had. The great teams. I'm interested. Who are you talking to here? You're trying to talk to your staff, you're talking to the public, you're talking to carers and so on. Great teams, we're very much moving towards, as you've said, families, voluntary sector, those networks all being part of this, creation of health, of which you're a part, and you're going to be working very closely with it. So it might be that you could expand that there to include a bit of a more holistic sense of that partnership to deliver health.
Yes, I agree. I think that the partnership element is critical. I quite like the fact that the purpose is quite short and snappy, but it's true that the partnership and the teams element needs to be understood much more broadly than just your traditional the 5 colleagues you work with on a daily basis. And I think as we come to the rest of the strategy, that will come up more.
Great care, great teams, great communities.
Thank you for the suggestion, Veronica. I think perhaps, Jenny, thank you for the question about whether we're inclusive enough around reaching out to all people. I think some of the questions that we're seeing might be helpfully answered if we move on to say what it is that comes next in our strategy. So the next element is our aims that Amelie was talking about. So these are the three aims that we are proposing to have in our strategy. So this would sit together with those, with the vision and the purpose, to describe the outcomes that we really want to achieve over the next 5 years. And we hope that you can see a sense of some of the questions that have been raised here. So the first one around patients, carers and families. So we really do want to be improving quality of life and experience of care. So that really is thinking about patients beyond them as individuals, but carers and families too. It's about how people access our services, the voice of our patients and families and carers, and they're at the centre of all that we do, and we really are striving to improve quality of life. The next one is around communities and population health. As Amelie has said, this is really about thinking about people beyond our patient lists and our patient wait lists that we have at the moment, to think about how we can tackle and add to community health, population health, and reduce inequalities across the communities that we serve. We recognise that we've got an important role in research, and so having an aim around communities and population health, we really want to add to on a large scale to make a difference across a much wider geography, to improve the health of people and communities. The third one here is an aim around ensuring that our own colleagues are well supported in the work that they do, to ensure that our culture supports our colleagues to thrive, to learn and deliver the very best care possible. So we recognise that we cannot do the first two. We cannot achieve our aims on patients, carers and families, or communities and populations health without a real focus on our staff. So we'd really like to hear what you think about these aims. These aims are supported by some priorities as well, which we'll come on to, that are a bit more specific. But we'd really, as our outcomes that we want to achieve, do these feel clear to you? Do you think these are the right ones that we should be focusing on over the next 5 years? Do they reflect what matters most to you, to your families, to your communities? And is there anything you might expect to see that you don't but would like to? Mike, I can see you've popped in the chat that the aims are fine, but what is the likelihood of achieving them? So some really important questions there raised around how do we get that more specific? How do we get some tangible measures on these things? So we, just to reassure you that we absolutely intend to do that, but we want to make sure that we've got the right sentiments first. Are they going to be focusing on the right things before we try to identify firm measures? But we absolutely will do that.
Yes, it's really important that we're honest in the way we set our strategy. We want to be ambitious. We want to be doing the right things, but we don't want to be saying things that we cannot deliver. So the measures that Sam is referring to will be our way of saying that's what we think can be done in the next 5 years. There was also a comment. There was also a comment in the chat that I think disappeared about the research, and I think it's true to say the general population may not know about our research work. However, the work that our colleagues at Oxford Health are doing on research has the potential and is already improving the quality of life of people on a global stage, and that's a really important element, specifically for mental health. We know that that's an area of healthcare where the research effort has not been to the same level as physical health, and therefore there's a big job to be done to improve treatment options for people with mental health illnesses that can really help people on a much wider geography than even the United Kingdom.
Thank you there. And can also see a comment in the chat around co-creation and dissemination with communities and how important that is. So as I said, we do have some specific priorities that are attached to this. So I hope that question is becomes more clearly answered with our priority, where we've got a very clear focus on how it is that we hear patients and how it is that we put the voice of patients, carers and families at the heart of the care that we provide.
And I think, Sam, that links with the next comment that was published on that. And I think for me, co-creation is not an aim in itself. You do it to improve the quality of life and the outcome. So that's why it's, as Sam said, we've identified this as a priority, because why do we co-create? Why do we involve people? Because we know that's the right thing to do to improve quality of life and health outcome and experience of care. So we'll come to it.
Thank you. I think, Barry, did you have your hand up?
I do.
A question.
Oh,
Yeah.
Sorry, I've joined late. I had difficulties getting on. Does the health include well-being? That generalized feeling of well-being?
Thanks for the question, Barry. So we really have thought about how it is that we can make that contribution to the wider determinants of health, those well-being issues, to keep people well, to think more about wellness than we do about sickness. And so our aim around helping improve the health of people locally, nationally and beyond is very much an indication of our commitment at the highest level to make a difference in wellness arenas. That is quite a step change for us as an organisation. We have increasingly worked on prevention and early intervention with healthcare to prevent people deteriorating and so on. But this is definitely a signal for us that we want to make a further inroads into that approach and help people with their overall well-being and prevent people from becoming ill in the first place. So, yeah, thank you for the question. But yes.
Yeah, I think that's very important, because in belonging to a significant health club, I think you could engage a lot more with health clubs around Oxfordshire in particular, in engaging them in the process.
Yeah, thank you very much for the point. That's well made. Thank you. So I've got a couple more questions in the chat. One from Helen around, does this cover the move from analog to digital? So we will come on to describe a little more around our priorities, but we recognise that digital is such an important area for us to think about, that we have we're proposing that as part of this strategy, we have that as something that we would call our strategic foundation. So that's like a really core part of what it is that Oxford Health does, that we must need to keep doing well. We must think of how we can advance services and access to services through digital means, and care, how we can advance care in that way too. But of course, always making sure that we keep an eye on those who are maybe digitally excluded. So thank you for your question, Mike, around how our aims relate to managing expectations and how you can be confident that we will deliver. We certainly we have something that we are developing alongside our strategy that's an important step for us as an organisation to respond to both a national ask, but helps us be really, really clear around how this strategy will be delivered. And that's something called a medium-term plan. So that will set out for the next 5 years what it is that the actions effectively that we will take over the next 5 years to make sure that this strategy isn't something that's simply written on paper, but has a real plan for delivery. So I hope that helps provide a bit more assurance on that. Veronica, thank you for your point around patient voice and how important that is in research. We really recognise that. A question there, or a comment around how we propose to link the aims to the vision. So we absolutely think that these aims are the right ones to achieve that vision. And if I come on now, I think probably it's useful, because we're getting into conversations around co-production and patient voice. I think it's useful to move on to the next slide, which expresses our proposed priorities. So what we have got is 6 priorities that we believe if we focus on, we can achieve those outcomes for our patients, carers and families, for our communities and our population, and for our own people, our own colleagues. So these are the priorities that we believe we should focus on for the next 5 years. So the first one really does speak to what it is that has been raised this afternoon around working in partnership with patients, carers and families and their communities to achieve meaningful outcomes. So this really is about that patient voice, changing the balance of the power that exists between services and patients, carers and families, to put the voice of patients at the heart of what we do, and focus on the outcomes that are meaningful to our patients, carers and families, not ones that we define. So that's our first priority. We really think that that's one of the things that we should be very much focused on. The next one is around make things simple. So this is a little bit talking to that digital agenda, but it's really also about it's not just about our systems, but it's about our processes as well, that we want to keep simple as possible to improve the experience of care that patients, carers and families have, but also to help our own colleagues in carrying out their roles. We want things to be as simple to navigate as possible. So that's our second priority. Our third proposed priority is around collaboration with partners and leading where agreed. So to some of the earlier conversations that we were having around how important it is that we are not a standalone organisation. We cannot deliver these things in isolation. We must work with everyone and anyone to make sure that we deliver the best patient care. So we really do want to work with others to innovate and improve patient care, population health outcomes, and the value for healthcare. And when we say value, we really mean what is it that adds value to people's lives in the most effective and efficient way possible. The next priority is around to tackle health inequalities by identifying and supporting people most at risk of poor health outcomes. So this is a signal of difference for us to really focus efforts on how we can prevent and intervene early to help improve the health outcomes for those who we know experience quite a disparity in the way that they both access healthcare, but what happens for people in their own health in the longer term. So that's a really important change for us too. The next one is foster a positive and inclusive working culture. So we heard from staff in phase 1 that this as an organisation that people do feel proud to work for and they enjoy working here, but we know that we can do more to make sure that that is a universal experience for all staff. So we really want to focus to make sure that all colleagues feel safe, feel valued, respected and supported to thrive at work. And then the 6th priority, deliver high quality care through QI, which means quality improvement, innovation and research. So QI is a particular term. Quality improvement is about how do you make small improvements through a systematic approach that really makes a difference to patient care and the outcome that patients experience. And we do that by being through a learning organisation. So we really want to continue to be a learning organisation, but create and share and use knowledge to improve care. We think it matters a great deal to not simply focus on research as the way to improve care, but to really think about how we use those other methods as well in our day-to-day work, but also in those certainly in those higher value research projects that might make a real difference to health nationally and beyond. So we get those are our 6 draft priorities. We'd really like to hear what it is that you think about those. Are they clear? Do you think that if we focused on these, we would make care better for you, for your families, for your communities? And is there anything else that you think that we should be focusing on? So I can see a couple of comments in the chat there. Is there anybody that would like to come in, or just go to Mike's comment regarding digital? What is known about the levels of digital exclusion among those with mental health conditions? It's a really good question, Mike, and thank you for asking it. We are an organisation with fantastic expertise in working with people with mental health conditions, and of course we have specific ways that we communicate with those with mental health conditions. Some of those are digital and some of those aren't, and we know we've got a specific directorate that works on learning disabilities, for example, so we have expertise in that area as well, where we amend and flex our communication according to the needs of our patients, carers and families, but we know that there's more that we could do there. So thank you for the point. Jenny, to your point around no mention of voluntary sector organisations as key partners, yeah, thank you for that question. It is an important one because, like I said, we're not an organisation that can deliver in isolation. We really do need to collaborate with partners, but we need to collaborate with lots of different partners, and that could include local authorities, other NHS trusts. We've got GPs and primary care. We work with dental practices across our geography. We work with an awful lot of different types of organisations. So when we say that we want to collaborate with partners, we want to collaborate with all partners, and the voluntary and community sector organisations are a really key part of that. We have been doing specific pieces of work to engage with our voluntary and community sector partners. We've written to a lot of them, both in phase 1 and in phase 2, to make sure that we raise awareness of the work that we're doing here, but to make sure that they too have a voice in what it is that we're doing. So thank you for the question.
Sam, can I pick up a point on digital, because I can see it's coming back in the chat. I think it's a really good point. Digital is not a solution for everything. There's a really strong push from the government to move to digital technologies, and our job as an organization is to respond to this and recognize that in a lot of cases it could make things much easier, and it's our job to make it work. However, we're very clear that for a lot of our services, for example, we provide inpatient services where people come and stay in our hospitals. In this case, what does digital mean? So we're very clear that it's not a one-size-fits-all. Digital is going to sort everything. We're going to apply it across all of our services, etc. So we want to take a very careful, thoughtful approach to that. So what we want to be clear is what are the aims and the priorities we want to deliver. And then we develop a specific digital strategy. We say, okay, now that we know what our priorities are, the outcomes we want to deliver are, how can digital help? And in some areas, there may be a lot of opportunities to use digital, in other, less so. And I think we're very clear on that, and we will spend the time to carefully consider this at the back of this strategy. So we're very conscious of that, and the fact that it's not a solution for everything. I just wanted to say that because it's a thread that is coming back in the comment session.
Thank you. Can also see a hand up there. Is that
That's
Mujahid?
right, yes. Do you want to go to the hand first, and then we have got some
Hi there,
comments.
Mujahid. Could I bring you in? I hope I've pronounced your name
Yeah,
correctly.
I am so sorry. My name is Hassan. I'll change the name. It's my other colleague. It's my work as Zoom colleague, and I'm just want to add it. It's still the technology keep asking the questions, but the how is still I'm hearing the answer. It is not very thoughtful because there's not a lot of people have that technology. Not a lot of people got an email. Not a lot of people have a laptop. Not a lot, and then it has to be in honest thought. How do you engage those people? How would you make them that you hear their voices? And that
Yeah.
for me is still, anytime I'm listening with the NHS team, and it's still, it comes up like it. We know how to deal with it. We know what we're doing, and how we understand how, and it's not. It's still, it's keep a lot of people that news are not getting there. Then you need to give them more time and this stuff to go visit them where they are, where the community are. You know, it keep happening all the times. This amazing work that you guys are doing, that a lot of people are missing. A lot of people are not there. And secondly, when you're talking about communities, be honest about it. If things that you're doing is not working, it's good to say it. It is nothing wrong about a learning and see how different the community can work with you guys and listen to it. But if we're not saying that, we still keep going 5 years time again, sitting in here and talking about the same thing. You know, friendships, partnerships, honesty, trust is built by community. Community is now, you don't have the trust, and we have to admit to that, because a lot of people are coming to you guys and the conversation and information are not there. Is always the same voice that we're hearing. Now, when we see something is happening, we want to work because I value the NHS. I'm always say the work that you guys are doing and the people and the staff are it's unspeakable. It's the amazing things they do, and the little ones we can improve together. Community can be there and seeing the value what NHS mean to every of us and every single person in the world. That is NHS is an amazing organization to have, but at the moment, the government, the people who are running it, are always keeping the information that it's not matter to the communities. Community only needs this is really not working. How do we work together? How do we make it this workable where we are? And that's all I can add. But the technology, do not run away with it. It is a lot of majority people does not have that technology in their home or their places.
Yeah, thank you so much for those. I can really hear the passion, Hassan. Thank you so much for bringing those points forward. I have to say, through this particular piece of work, we have done our best to engage with community groups who represent those voices that are traditionally less well heard. So we have made efforts through representative groups, not directly, and we have to hold a mirror up to ourselves in this process to understand in the future how can we build those relationships, build that trust, because we recognise that that's not as strong as it could be. So we have relied upon the voices of those less well heard to come through the community groups that represent them. So we really hear your point around that. We do have an experts by experience reference group that we are working with to develop this strategy. So we are bringing patients, carers, families into to work alongside us in a co-productive way to try to make sure that the voices, for example, of those with mental health who are traditionally less well heard voices, are working alongside us in this strategy. So I hope that provides both a bit of honesty, but also recognition that we are making efforts to make sure that those voices are heard. And what we want to signal in this strategy is that we want to do much more of that. We know that we can go much further. So I wanted to say that. With regards to what's not working, we very much heard that through our phase 1 of engagement, and the priorities that we are suggesting going forward have been suggested not simply in response to, but in reflection of some of those things that we know aren't working well. Making things simple, for example, is certainly about how do we make access to our services that much quicker and easier, because we do know that we've got some real challenges in those areas. Okay, I don't see any other hands up, but I did want to, I can see in the chat that there's a particular couple of points on integrated neighbourhood teams, and that is a really important part of the 10-year plan. And I wanted to just signal to you that we feel very much as though integrated working and integrated neighbourhood teams and neighbourhood health and care is absolutely a priority for us as a way in which we would achieve the priorities. And if I speak to them directly, the first one would be about how we work in partnerships with patients, carers and families in a far more closer to home manner. So that's much more integrated neighbourhood team approach, would be absolutely delivering on working in partnership with patients. It's also about how we collaborate with partners, so voluntary and community organisations, primary care, and population and communities themselves. How do we work together around neighbourhoods? And the third one is really important for us too, around tackling health inequalities. So we see neighbourhood as a way in which we would deliver these priorities. I hope that makes sense, but neighbourhood is absolutely a thing that we are thinking about as in relation to all of these priorities. But thank you for those points.
And Sam, there was also on a different topic, a point on outcomes. And yes, we can think about the wording about meaningful outcomes. What we meant was outcomes that are meaningful for the people who are accessing our services or in the communities, but we can think about the wording of that so it sounds less bland. But how will we know? So we are starting to get much better in the NHS overall and in Oxford Health at recording outcome data. And it's about, mostly in our mental health services, what is meaningful for people. So what would they want to see as a meaningful outcome throughout their treatment? And at the end, have they, has this outcome been delivered? So we're starting to be able to track outcome and to see if there is improvement in the outcomes for the people who are accessing our services. So that's why in our next strategy, we can start saying, well, are we being successful in that ambition to improve outcomes? Because we are going to be able to measure it through our data. We're only starting, the data is not very good, but we will get to a point where we're able to see this much more systematically across our services, starting with our mental health services.
Hi there, thank you. I can also see a point here around where we would put health education and prevention. So I'm guessing that we mean health education and prevention in terms of population health here, because to health education points, that's very much about our staff and our colleagues, but I think that this point is in reference to population health. So that very much is around using, that's about tackling health inequalities. So using data and evidence to focus our efforts on prevention and early intervention, and this important second part to improve long-term outcomes for local communities. So that really is a focus on that broader population health. How can we help people stay healthy for longer? And it does tie, of course, into the priority around working in partnership with patients, carers and families, because that's ultimately got to be a tailored approach to what works for individuals. Okay, I can see some really fantastic comments in the chat. Concern around how we work with voluntary and community sectors, and perhaps that we can strengthen our wording around partnership working, perhaps be more explicit in the more detailed explanation of our priorities in the strategy itself. Amelie, did you want to come in?
I think this is obviously a really important part of how we work, and specifically in our mental health services, and that's also very relevant to the national agenda on neighbourhood and how we deliver care at the local level. So beneath this priority, we'll set out how we will work with specific partners, especially at the neighbourhood level, and that will definitely include our VCSE colleagues.
Lovely, thank you. Mike, you've made a point that as we are nearing the end of this webinar, and we do have a couple of more minutes left, you're not hearing why you should be confident that we will deliver what it is that we say we will. So I did just want to circle back round to something that I said earlier about our medium-term planning and the way in which we will be linking this strategy, whatever it is that our aims and our priorities are confirmed to be. And we think that as we finalise this strategy, there's likely to be changes to the emphasis and the words here, but we hope that we've got broadly a lot of the content right. But what we are doing is making sure that we are thinking about the next 5 years as we are developing this strategy. So we plan to publish this strategy and agree it with our board in the summer. And then we will be publishing a medium-term plan, which will say that for the next 5 years, what it is that Oxford Health is going to deliver. That takes into account the NHS targets and restrictions and budgetary challenges that we have. And we will set that for 5 years. In addition to that, we undertake a really robust planning process every year, an annual process, where we break down how it is that we will spend the resources, the funding that we have, how we will allocate that against our workforce and our colleagues, and how we will fund services to deliver on both the national targets that we must deliver, but also what it is that our priorities are locally. So this strategy is designed to set out what it is that we will focus on. That is a high level, and it is there's broad sentiments, but it doesn't sit alone. It will sit with a medium-term plan that sets out the 5 years and an annual plan that really breaks down exactly how many appointments and what our waiting time changes will be, and so on and so forth on an annual basis. So this is the very start of that long-term planning process to make sure that we're engaging and focusing on the right things. So I hope that does provide a bit more assurance. We have been undertaking an annual planning process for a number of years now, and those can be found on our website, and we can circulate those if that's helpful, so you can see what that looks like, where we've got numbers and priorities against the budget that we have. But we will be doing that over 5 years with this new strategy when we get there. I hope that's assuring. Barry, I've got your hand up that I can see. I'm going to come to you for the last thought or comment.
That's good. Yeah, if we take Barry's question and then wrap up, and I can see that Helen has put a link in the chat to the survey, so people can add more feedback and comments through that. Thank you, Sam. Barry, do you want to ask your question, make your point?
You need to unmute yourself, Barry.
I thought it was. One of the observations I've got here is that how you are marking your own homework all the time, and how are you going to make sure that the truth is coming back up the system and that you can react if things are going off course? In the last 2 years, I and my wife have been major users of the health services, and in some ways, I've had to react in a very big way through the press and so on to get action. And only by causing that to happen have people reacted. So I'm not saying that it won't happen, but I'd like to think there were more checks and balances in the system to make sure it does happen, because the consequences of failure are very big.
Thanks, Barry. I think it's a very valid point. As Sam said, we're trying to be very transparent as an organization. So showing our plan, saying that's what we're going to do, and then saying that's what we've delivered in year. And we were working closely with local health partners like integrated care boards and our regional teams that are overseeing.
Which is no longer in existence.
It does exist. It's a Thames Valley Integrated Care Board.
Yeah.
So we're working closely with them, obviously, and sharing our data and outcomes. But I'm conscious, obviously, the NHS, like any system, is not perfect, and there is definitely room for improvement. So thanks for making this point.
Thank you, Barry and Amelie. So I think we have reached the end of our webinar. Veronica, are you going to close us down?
Yes. Well, thank you so much to Amelie and Sam and Oxford Health staff for this. And we'll really look forward to seeing how it develops. And perhaps we'll get you back in a year's time to see how this is progressing and follow it up. The recording will be on both Healthwatch Oxfordshire and Healthwatch Buckinghamshire's website for people to watch who haven't been able to. And please do fill in the survey with the link there. We will put that survey link as well next to the webinar on our website along with the slides. So thank you so much everybody for coming and contributing to this really important discussion. It's great to see you all. And thank you to our speakers once again. We'll close the session now.
Thank you.